midwife is a regulated health professional who provides expert care to low-risk individuals throughout pregnancy, birth, supporting their babies until they're 6 weeks of age as well. There are over 1,000 midwives working in Ontario, and it's estimated that we attend about 20% of Ontario births. It is important to note that a midwife is not a doula. A doula is a support person for someone in labor who provides emotional and physical support, but is not a trained healthcare professional. In addition to providing labor support, midwives also prescribe medications, order ultrasounds, organize lab work, consult with physicians, as well as deliver babies in a variety of settings. In Canada, they can attend one of 6 Canadian midwifery schools and complete a 4-year bachelor's degree. Of this 4-year degree, 2 of these years are hands-on clinical practice so that these new midwives have the skills they need to become competent midwives working in hospitals such as this one. For internationally trained midwives, they can become practicing Canadian midwives through an assessment and orientation program organized by our college. Midwives are part of the Canadian and Ontario healthcare system, meaning that we are paid for by OHIP and our services are free for any Ontario resident. Our care is self-referred, meaning that you do not need to see a family doctor to access midwifery care. Typically, we see our clients for the first time in office between 9 to 12 weeks of pregnancy, follow them with appointments that get more and more regular towards the end of a pregnancy until 6 weeks postpartum. Typically, the number of midwives a person meets is between 1 to 3, so that circle is kept small and very intimate. We are the only regulated health profession practicing and working in Ontario that can offer birth in a variety of settings. What this means is that clients who are with midwives have the opportunity to birth in hospital in places like CMH, also in birth centers that are midwifery-led in certain communities, as well as the possibility of laboring in their homes if they are appropriate candidates for this. We will provide some of the same care that a nurse will, but then also some of the same care that a doctor would provide. So in terms of determining someone's risk level, determining when ultrasound should be ordered, how lab work should be interpreted, what prescriptions are required for that person, if any. We were also looking at the larger picture in terms of the larger aspects of management at both home and in hospital as well. It is imperative that the care that we provide is collaborative. That is how we can ensure safe and appropriate care for our clients, is having fantastic relationships with other members, CMH staff, nurses, physicians, with other staff members and administrators, that we understand what our scope of practice is. And then we can also seek assistance, seek consultations with various physicians, should we require them, for moms or babies. We are forever grateful that we have really great collaborative relationships with staff here, which, like I said, allows us to access safe and appropriate care for our clients. I truly value being a member of CMH staff, and I truly value the relationships that we have with other members of staff as well. I started working here in the summer of 2020, which meant that it was a very different time than it is now. Certainly nothing in my education prepared me for walking into my first couple of years of my professional career in the middle of a global pandemic. But all things being said, it was still a very supportive environment. I still felt like I was accepted by my colleagues as well as nurses and doctors that we were working alongside. But all in all, it's still a place that I really enjoy working. Yes, yeah, it's a pretty magical thing. Yeah. Certainly I am forever and always grateful for the immensely important role that I get to play in the lives of new families. Every day that we work is different. Certainly there are some fantastic days, there are some sadder, longer days, and obviously managing emergencies is a part of my job. But I'm truly thankful for the work that I do, and I can't imagine being a midwife anywhere else but this hospital, and I certainly can't imagine doing anything but midwifery at this point in my career.